All right, get ready because we're taking a deep dive today into something pretty important, actually. Acute heart failure.
Yeah.
It's basically when your heart suddenly just can't keep up with your body's needs,
Right.
like a pump that's just not strong enough anymore.
Mm.
We're going to break this down using a couple of sources.
Okay.
We've got a chapter here from a medical textbook all about acute heart failure.
So good.
And we've also got a document specifically on pulmonary edema,
Okay.
which is a common and potentially dangerous complication.
Right.
So by the end of this deep dive,
Mm-hmm.
you should have a really good grasp of acute heart failure.
Right.
What causes it, the warning signs,
Mm-hmm.
and how doctors manage it.
Okay.
So whether you're prepping for like a medical presentation or just you're curious about all this,
Mm-hmm.
this deep dive should give you some useful knowledge.
You know, it's surprising how common acute heart failure is.
Oh, really?
And the thing is, a lot of patients end up back in the hospital after being discharged.
Oh, wow. So it's a revolving door kind of thing.
Unfortunately, yeah.
That's concerning.
Mm-hmm.
So let's start with the basics.
Okay.
The textbook defines acute heart failure, or AHF, as basically a bunch of symptoms
Okay.
caused by problems with the heart's structure or function,
Mm-hmm.
which basically makes it hard for the heart to fill with or pump out blood.
Right.
And there are two main types of heart failure.
Yeah.
One where the pump itself is weak,
Okay.
which is called HFrEF,
Mm.
and another one where the heart muscle gets stiff,
Yeah.
making it hard to fill with blood.
Mm-hmm.
That one's HFpEF.
Right.
Can you explain the difference between these two for our listener?
Yeah, sure.
Okay.
Um, your heart's pumping power is measured by something called ejection fraction.
Okay.
It's the percentage of blood squeezed out of the left ventricle with each beat.
Okay.
A normal ejection fraction is between 55 and 70%.
Okay.
Now, in HFrEF, the heart muscle is weak,
Mm-hmm.
so it can't pump out enough blood,
Oh.
and that results in a low ejection fraction
Right.
below 40%.
Mm-hmm.
But in HFpEF, the heart muscle is stiff,
Okay.
so it's hard for the ventricle to fill up with blood,
Okay.
even though it might still be pumping out a normal percentage.
Oh, I see.
And, that stiff heart type,
Mm-hmm.
HFpEF, it's becoming more and more common these days.
Oh, wow. So
Yeah.
it's like having a leaky pump versus a stiff container. Both lead to problems, but in different ways.
Exactly.
And you said anything less than 35% ejection fraction is like
Yeah.
a real red flag, right?
Absolutely.
Okay.
That signals a life-threatening situation.
Yeah.
Needs immediate attention.
Okay. That puts things into perspective.
Mm.
Now, what are some things that can actually trigger AHF in the first place?
Well, there are a few things.
Okay.
One of the most common is ischemic heart disease,
Okay.
where plaque builds up in the coronary arteries,
Okay.
which are like the heart's own little plumbing system.
Mm-hmm.
This buildup restricts blood flow to the heart muscle, leading to problems.
So it's like a clogged pipe
Exactly.
starving the heart of the blood it needs.
Precisely.
Okay.
Then there's myocardial infarction or a heart attack,
Yeah.
where part of the heart muscle is damaged
Mm-hmm.
due to lack of blood flow.
Okay.
And finally, there's valvular heart disease,
Okay.
where the heart's valves malfunction,
Mm-hmm.
disrupting blood flow.
Gotcha. So it's kind of like this
Yeah.
domino effect.
Oh, yeah.
One problem leads to another, and ultimately it affects the heart's ability to just function properly.
Exactly.
Now, how does AHF impact the body as a whole?
Right.
It's not just the heart that suffers.
No, not at all.
Okay.
Our bodies are amazingly resilient.
Okay.
So when the heart starts to struggle,
Mm-hmm.
it triggers all these compensatory mechanisms
Oh, okay.
to try and make up for the reduced function.
So the body's trying to
Yeah, it's
break up the slack for the heart.
Yeah, calling in reinforcements.
Okay, interesting. Looking at these sources, it sounds like these mechanisms can actually backfire over time.
That's right.
Oh.
Initially, they're helpful,
Mm-hmm.
but in the long run, they worsen the situation,
Okay.
leading to two main problems.
Right.
Congestion and hypoperfusion.
Okay, those sound kind of technical.
Yeah.
Can you break those down a little?
Sure.
Okay.
Congestion is basically fluid buildup.
Okay.
When the heart can't pump efficiently,
Yeah.
blood backs up,
Mm-hmm.
increasing pressure in the veins.
Okay.
This forces fluid to leak into surrounding tissues,
I see.
like water overflowing from a clogged sink.
Yeah. Okay.
And in acute heart failure, this often leads to pulmonary edema,
Oh.
where fluid accumulates in the lungs.
So it's like the lungs are
Yeah, you could say,
drowning.
yeah, that's a good way to put it.
Okay.
Our source describes one patient experiencing this as like
Oh.
a sudden sensation of suffocation
Oh, God.
and extreme anxiety,
Wow.
even coughing up pink foamy fluid.
That sounds terrifying.
Yeah, it does.
Okay, now the opposite problem
Right.
is hypoperfusion,
Mm-hmm.
which is reduced blood flow to vital organs.
Right.
This happens because the weakened heart just struggles to pump enough blood
Exactly.
throughout the body.
Yeah.
So organs like the kidneys, liver, brain,
Mhm.
they don't get what they need.
The oxygen and nutrients.
Yeah, and that sounds really dangerous.
It is.
Okay.
And if hypoperfusion gets severe,
Yeah.
it can lead to something called cardiogenic shock,
Oh, wow.
which is a life-threatening condition
Okay.
where the heart is so damaged it just can't pump enough blood
Yeah.
to meet the body's basic needs.
It's like a
Yeah, like it's...
circulatory collapse.
Yeah,
Wow. So AHF can really
Yeah.
snowball into a serious situation.
absolutely.
Now, let's say you're in the emergency room.
Okay.
What signs and symptoms
Right.
would make you suspect someone might be experiencing acute heart failure?
Well, the symptoms can vary
Okay.
depending on the severity
Mm-hmm.
and which side of the heart is affected.
But some common red flags are
Okay.
sudden shortness of breath,
Mm-hmm.
difficulty breathing when lying down.
Mm-hmm.
We call that orthopnea.
Gotcha.
And coughing up pink foamy sputum,
Yeah.
which is a classic sign of pulmonary edema.
Our document on pulmonary edema
Yeah.
also mentions things like anxiety,
Mm-hmm.
delirium,
Right.
poor circulation in the
Mhm.
extremities,
Mm.
and even muscle weakness.
Right.
So it seems like the body's really struggling.
Absolutely.
And it's important to remember that these symptoms can come on
Quickly.
suddenly and
Yes.
progress rapidly.
Right.
So seeking immediate medical attention is so important.
Yeah. Early diagnosis and treatment are crucial.
Okay, so let's talk about
Yeah.
diagnosis and treatment.
Yeah.
What are the steps involved in actually diagnosing AHF?
Okay.
And how do doctors manage it?
Well, it usually starts with a thorough physical exam
Okay.
and a review of the patient's medical history.
Then doctors typically order a series of tests
Okay.
to confirm the diagnosis
Yeah.
and see how severe the heart failure is.
So what kind of tests are we talking about here?
Well, one of the most common is an electrocardiogram, or ECG.
Okay.
It records the heart's electrical activity
Mm-hmm.
and can help identify irregularities in the heart rhythm,
Okay.
which can be a contributing factor to heart failure.
Mm-hmm.
Another important test is a chest x-ray,
Okay.
which can reveal fluid buildup in the lungs,
Mm-hmm.
a hallmark of pulmonary edema.
And then there's the echocardiogram,
Yeah.
which I've heard is like the gold standard
Yeah.
for evaluating heart function.
You're right.
Okay.
An echocardiogram uses ultrasound waves
Okay.
to create detailed images of the heart.
Okay.
It lets doctors see the size and shape of the heart chambers,
Mm-hmm.
how thick the walls are, and how well the valves are working.
Gotcha.
This information is crucial
Mm-hmm.
for determining the type and severity of heart failure.
What about blood tests?
Right.
Are there any specific blood tests that are...
Yes, there are.
Okay,
One important blood test measures levels of a protein called BNP,
okay.
or B-type natriuretic peptide.
Mm-hmm.
The heart releases BNP when it's under stress.
Okay.
So high BNP levels can indicate heart failure.
So it's like a distress signal from the heart.
Exactly.
Okay.
Our document on pulmonary edema actually mentions specific BNP values
Okay.
and what they mean.
Okay.
A BNP level below 100 pgml is usually considered normal,
Gotcha.
while levels above 900 pgml are associated with severe heart failure.
Okay, so once the diagnosis of AHF is confirmed,
Right.
what does treatment look like?
Well, the goal is to relieve symptoms,
Okay.
improve heart function,
Yeah.
and prevent further complications.
Okay.
Treatment for acute heart failure is multi-pronged
Mm-hmm.
and typically involves medications and lifestyle modifications.
So let's start with medications.
Are
What are some of the common drugs
Mhm.
prescribed for AHF? One of the first lines of treatment is diuretics.
okay.
They help to remove excess fluid from the body,
Mm-hmm.
which reduces congestion,
Okay.
makes it easier for the heart to pump.
So it's like draining some water out of that
Exactly.
overflowing sink we were talking about.
Exactly.
Okay, makes sense.
Mhm.
What other types of medications are used?
Another important class of drugs is vasodilators.
Okay.
They relax and widen blood vessels,
Mm-hmm.
which lowers blood pressure
Okay.
and eases the workload on the heart.
And what about those inotropes I've heard about?
Yeah.
What do they do exactly?
Imagine your heart is like a tired muscle struggling to pump.
Okay.
Inotropes are like giving it a shot of espresso,
Okay.
helping it contract with more force,
It's like a booster.
with the washer for the heart.
Exactly.
Okay, that's amazing.
They're particularly helpful in severe cases when the heart's really struggling.
Okay, now what about
Right.
non-pharmacological interventions.
Yeah.
Are there other treatment options?
Yeah.
Especially for severe cases?
Absolutely.
Okay.
For patients with severe AHF who don't respond well to medications,
Mm-hmm.
mechanical circulatory support devices might be necessary.
Okay.
These devices assist the heart in pumping blood.
Can you give us some examples of those devices?
Sure. Okay.
One example is an intra-aortic balloon pump, or IABP.
Okay.
It's a device inserted into the aorta, the main artery carrying blood from the heart.
Okay.
And it helps improve blood flow
Mm-hmm.
and reduce the workload on the heart.
It's like giving the heart a helping hand.
Exactly.
Are there other devices like that?
Yes, there's extracorporeal membrane oxygenation, or ECMO.
Oh, wow.
It's a more advanced form of life support
Okay.
that essentially takes over the function of the heart and lungs,
Wow.
allowing them to rest and recover.
Okay.
It's usually used in the most critical cases.
Wow. That's incredible.
Mm-hmm.
Our sources also mention ventricular assist devices, or VADs.
Right.
What are those? VADs are implantable devices
Okay.
that help pump blood from the heart to the rest of the body.
Okay.
They're often used as a bridge to heart transplantation
Oh, wow.
for patients with end-stage heart failure.
So there's a whole range of options
Yeah.
for supporting the heart.
Absolutely.
It's amazing how medical technology is evolving.
Yeah, it is.
Now, I want to shift gears a bit
Okay.
and focus specifically on the respiratory aspect of AHF.
Right.
We've mentioned it briefly.
Yeah.
But breathing is so vital,
Mhm.
it deserves a closer look.
Yeah, absolutely.
Can you tell us how AHF impacts breathing?
Sure.
Okay.
When the heart isn't pumping effectively,
Mm-hmm.
blood can back up in the lungs,
Okay.
creating pressure
Mm-hmm.
in the pulmonary capillaries,
Yeah.
those tiny blood vessels in the lungs.
Okay.
This pressure forces fluid to leak into the air sacs,
Mhm.
making it hard to breathe.
Okay.
Respiratory support aims to improve oxygen delivery
Yeah.
and reduce the workload on the lungs, while the underlying heart failure is being treated.
So it's like
Thanks, Kay.
trying to inflate a balloon underwater.
Exactly.
Okay. Makes sense.
Mm-hmm.
There are several types of respiratory support,
Yeah.
ranging from non-invasive to invasive,
Right.
depending on how severe the breathing problems are.
Mm-hmm.
Okay, so for example, there's CPAP,
Right.
which stands for continuous positive airway pressure.
Mhm.
It's a non-invasive form of ventilation
Okay.
that helps keep the airways open and improves gas exchange.
What about BiPAP?
Yeah,
I've heard that term used for sleep apnea,
right.
but does it also help with AHF?
You're right. BiPAP is used for sleep apnea,
Mm-hmm.
but it can also be helpful in AHF.
Okay.
It's similar to CPAP,
Mm-hmm.
but provides two different pressure settings,
Okay.
one for inhalation and one for exhalation.
Oh, I see.
This is especially helpful for patients who are struggling to exhale effectively.
Okay. And our sources also mention high-flow nasal cannula,
Mm-hmm.
or HFNC. What's that?
Right.
HFNC is a newer technology
Okay.
that delivers heated, humidified oxygen at a high flow rate.
Okay.
It's generally comfortable for patients
Mm-hmm.
and can be very effective at improving oxygen levels.
So there are a lot of options
Yeah.
for respiratory support, but I imagine the best choice depends on the individual patient
Right.
and how severe their condition is.
That's this. Good.
Okay.
It's all about finding the right balance.
Mm-hmm.
Our sources emphasize the importance of starting with lower settings
Okay.
and gradually adjusting them
Yeah,
based on how the patient is tolerating and responding to the therapy.
that makes sense.
Mm.
It's a reminder that medicine isn't one size fits all.
Right.
It's about personalized care.
Exactly.
Now, we've covered a lot of ground
Mm.
in this first part of our deep dive
Yeah.
to acute heart failure.
Right.
We've looked at the causes, how it affects the body,
Right?
the signs and symptoms,
Yeah.
and some of the treatment options, but we're just getting started.
That's right. There's much more to explore.
Okay.
Yeah. Before we move on,
Yeah.
I think it would be helpful to dig a little deeper
Okay.
into how those respiratory therapies are actually used,
Okay.
especially CPAP and BiPAP,
Hmm.
since they're so common in AHF management.
You're right. Those details would be really useful
Yeah.
for someone trying to understand, the finer points of treatment.
Exactly.
So let's start with CPAP.
Okay.
What are the key things to consider
Right.
when starting a patient with AHF on CPAP?
Well, our sources stress the importance of starting slow
Okay.
with a low level of PEEP,
Okay.
which stands for positive end expiratory pressure.
Mm-hmm.
Think of it like this.
Okay.
It's basically maintaining a little bit of pressure in the airways,
Okay.
even when the patient breathes out,
Mm-hmm.
to prevent the air sacs from collapsing.
Okay.
This helps improve how well the lungs exchange oxygen and carbon dioxide.
Mm-hmm.
A typical starting point is around 3 to 5 centimeter H2O, but doctors adjust it based on what the patient can comfortably handle.
Okay, so start low and go slow.
Exactly.
Got it.
Mm-hmm.
What about BiPAP?
Yeah,
Are there specific guidelines for starting and adjusting that therapy too?
absolutely.
Okay.
For BiPAP, the sources recommend starting with a pressure support
Okay.
of about 3 to 5 centimeter H2O,
Okay.
again, depending on the patient's comfort level.
Mm-hmm.
This pressure support basically helps the patient's own breathing efforts,
Okay.
making it easier for them to breathe.
Gotcha.
Then the PEEP setting for BiPAP
Mm-hmm.
can be slowly increased,
Okay.
aiming for a tidal volume.
Okay.
That's the amount of air inhaled with each breath,
Right.
of about 6 to 7 millimolar per kilogram of body weight.
So it's all about finding that sweet spot
Exactly.
for each patient,
Mm.
making sure they're getting the help they need,
Yeah.
but without making them uncomfortable.
Mm-hmm.
It's a good reminder that medicine isn't
Right.
a one-size-fits-all approach.
Exactly.
It's about personalized care. Now, I want to shift gears for a moment
Okay.
and talk about the long-term picture.
Okay.
We've discussed, the immediate challenges of AHF,
Right.
but what about recovery?
Yeah.
What does that look like for someone who's experienced this condition?
That's a great question.
Yeah.
Recovery from AHF can be different for everyone,
Okay.
depending on what caused it,
Mhm.
how severe it was,
Yeah.
and the person's overall health.
Okay.
It's important to understand that AHF is often a chronic condition,
Okay.
meaning it requires ongoing management
Okay.
to prevent future episodes.
So it's not a one-and-done situation?
Not really.
It's more like...
Adapting to a new normal.
Exactly.
Okay.
Lifestyle changes are crucial for long-term management.
Okay.
This includes a heart-healthy diet,
Mhm.
regular physical activity as tolerated,
Okay.
maintaining a healthy weight,
Yeah.
quitting smoking,
Mhm.
and limiting alcohol.
It sounds like a holistic approach.
Right. Addressing not just the physical aspects,
Mm-hmm.
but also the psychological and behavioral factors
Yeah.
that influence heart health.
Absolutely.
Speaking of those underlying causes,
Right.
we briefly mentioned
Yeah.
some of the common culprits behind AHF earlier. I think it's worth revisiting them
Yeah.
in more detail because
Mhm.
understanding the root cause is so important
Ab-
for
like-
effective prevention and management.
I completely agree. It's like solving a mystery.
Yeah,
You need to know who the culprit is
right.
to come up with a good plan.
Exactly.
So let's break down some of the most common causes of AHF,
Okay.
starting with coronary heart disease,
Okay.
which I know is a major risk factor for heart problems in general.
Okay, so coronary heart disease.
Yeah.
What exactly is it?
Okay.
And how does it lead to AHF?
Coronary heart disease, or CHD,
Mm-hmm.
happens when the coronary arteries,
Okay.
the blood vessels that supply the heart muscle with oxygen-rich blood,
Mm-hmm.
become narrow or blocked.
It's like a traffic jam in those arteries.
Okay.
And it's usually due to plaque buildup,
Yeah.
which we call atherosclerosis.
Okay.
This buildup restricts blood flow to the heart,
Right.
leading to chest pain,
Mm-hmm.
shortness of breath,
Yeah.
and eventually, if it's not treated,
Yeah.
it can cause a heart attack.
Okay.
A heart attack can significantly damage the heart muscle
Mm-hmm.
and often triggers AHF.
So it's a gradual process
Yeah,
that can have sudden and serious consequences.
exactly.
Now, we often hear about
Right.
high blood pressure being bad for the heart.
Yeah.
How does that contribute to AHF?
High blood pressure,
Yeah.
also known as hypertension, is
Yeah.
a major risk factor for AHF.
Okay.
Think of it like this.
Ah.
Over time,
Yeah.
high blood pressure makes the heart work harder
Mm-hmm.
to pump blood throughout the body.
Okay.
It's like constantly pushing a heavy object uphill.
Okay.
This extra effort can cause the heart muscle to thicken and stiffen.
Making it less efficient at pumping
Mm-hmm.
and increasing the risk of AHF.
It's like wearing the heart out over time.
Exactly.
And what about those heart valve problems we mentioned earlier? How do
Yeah.
those fit into the picture?
Heart valve problems,
Yeah.
whether present at birth
Mm-hmm.
or develop later in life,
Mm-hmm.
can really disrupt the normal flow of blood through the heart.
Okay.
You can think of them as doors that aren't opening or closing properly.
Okay.
This can lead to blood leaking back into the heart chambers,
Okay.
forcing the heart to work harder,
Yeah.
and ultimately increasing the risk of heart failure.
It's fascinating how these
Yeah.
seemingly small problems
Yeah.
can have such a big impact
Exactly.
on the heart's ability to function.
Mm-hmm.
Are there any other notable causes of AHF we should mention?
Yes, a few others are worth highlighting.
Okay.
Cardiac arrhythmias
Okay.
or irregular heartbeats
Yeah.
can contribute to AHF.
Okay.
When the heart's rhythm is off,
Mm-hmm.
it can't pump blood effectively,
Right.
which can lead to fluid buildup.
Yeah.
in the lungs and other parts of the body.
So it's not just the strength of the heartbeat,
Exactly.
but also the rhythm.
Yeah, the rhythm matters too.
Okay.
And then there's cardiomyopathy,
Okay.
which are diseases of the heart muscle itself.
Mm.
These diseases make it harder for the heart to pump blood.
Okay.
There are different types of cardiomyopathy. Some you inherit, and some caused by things like viral infections, too much alcohol,
Okay.
or certain medications.
Okay.
But regardless of the cause,
Yeah.
cardiomyopathy weakens the heart muscle,
Okay.
which can lead to heart failure.
It's a reminder that heart health is affected by so many things.
It is.
Genetics, lifestyle,
Right.
even things we might not be able to control.
Exactly.
And then there's congenital heart disease,
Right.
where the problem's present from birth.
Congenital heart defects are problems with the heart's structure
Okay.
that develop before birth.
Mm-hmm.
These defects can range from mild to severe
Okay.
and affect different parts of the heart,
Mm-hmm.
depending on the specific defect.
Yeah.
Congenital heart disease can lead to heart failure later in life.
It really makes you appreciate how resilient
Yeah,
the human body is,
it is.
especially when facing challenges from such an early stage.
Absolutely.
Okay, we've talked a lot about the causes of AHF,
Right.
but I think it's also important to discuss
Yeah.
those risk factors
Mm-hmm.
that increase a person's chances of developing this condition.
I completely agree.
After all, knowledge is power when it comes to prevention.
Absolutely. Understanding the risk factors
Right.
can help people make informed choices about their health
Exactly.
and potentially reduce their risk.
So let's dive into those risk factors.
Okay.
Starting with some of the more obvious ones,
Yeah.
like age and family history.
Okay, as we age,
Yeah.
our hearts naturally go through changes
Mm-hmm.
that can increase the risk of heart problems, including AHF. The heart muscle might not be as efficient,
Yeah.
and blood vessels can stiffen,
Mm-hmm.
making it harder for blood to flow smoothly.
Okay.
Family history is another big one.
Yeah.
If you have a family history of heart disease,
Mm-hmm.
especially heart failure,
Yeah.
your risk is higher,
Okay.
even if you live a healthy lifestyle.
It shows how much genetics can
Does.
play a role in our heart health.
Absolutely.
It's a good reminder that
Yeah.
we're not always in complete control,
Right.
but we can certainly tilt the odds in our favor by
Exactly.
focusing on the things we can control.
And that brings us to some of the modifiable risk factors.
Okay.
Those we can change or influence
Right.
through our choices.
Mm-hmm.
These include things like
Okay.
smoking,
Yeah.
high blood pressure,
Mhm.
high cholesterol, diabetes,
Mm-hmm.
obesity,
Right.
and a lack of physical activity.
Okay, let's break those down a bit.
Okay.
We all know smoking is bad for you, but how does it specifically affect the heart?
Smoking damages blood vessels,
Okay.
raises blood pressure,
Mm-hmm.
and reduces the amount of oxygen that reaches the heart muscle.
Okay.
All
Yeah.
of these things contribute to heart disease
Right.
and increase the risk of AHF.
It's a no-brainer to quit,
Yeah.
even if it's not easy.
Exactly.
What about high blood pressure and high cholesterol?
All right.
How do they impact the heart?
Well, we talked about high blood pressure,
Yeah.
making the heart work harder.
Right.
High cholesterol adds to the problem
Okay.
by contributing to plaque buildup in the arteries,
Mm-hmm.
further restricting blood flow.
Okay.
Both of these factors increase the risk of heart attack,
Mm-hmm.
stroke,
Yeah.
and AHF.
And then there's diabetes. How does that play into the mix?
Diabetes increases the risk of heart disease in a few ways.
Okay.
High blood sugar can damage blood vessels,
Okay.
making them more likely to develop atherosclerosis.
Mm-hmm.
And diabetes is often linked to other risk factors like obesity and high cholesterol.
Right.
It's like a chain reaction
Yeah.
with one problem feeding another.
Speaking of obesity,
Right.
how does being overweight affect heart health?
Carrying extra weight puts stress on the heart,
Okay.
making it work harder to pump blood throughout the body.
Mm-hmm.
It also increases the risk of other conditions like
Okay.
diabetes,
Yeah.
high blood pressure,
Mm-hmm.
and sleep apnea,
Okay.
all
Yeah.
of which can contribute to heart disease.
And finally, there's physical inactivity,
Right.
which seems to be more and more common these days.
You're right.
Yeah.
Not getting enough physical activity
Mm-hmm.
weakens the heart muscle,
Okay.
making it less efficient at pumping blood.
Mm-hmm.
It also increases the risk of obesity,
Yeah.
diabetes,
Right.
and other health problems that contribute to heart disease.
So leading a healthy lifestyle is clearly
Yeah.
crucial for protecting our hearts.
Absolutely.
But sometimes even with our best efforts,
All right.
AHF can still happen. What advice would you give someone
Let's
who
see.
has recently been diagnosed with this condition?
The most important thing is to work closely with your healthcare team
Okay.
to develop a personalized treatment plan
Yeah.
that fits your needs and goals.
Mm-hmm.
This plan might involve medications,
Okay.
lifestyle changes,
Yeah.
and sometimes more advanced interventions.
Okay.
It's about being proactive
Mm-hmm.
and actively involved in your own care.
So taking ownership of your health.
Exactly.
Okay. Yeah.
And don't be afraid to ask questions
Yeah.
and advocate for yourself.
Mm-hmm.
The more you understand about your condition,
Right.
the better equipped you'll be to manage it effectively.
That's great advice.
Knowledge is power.
Now, in addition to medical management,
Mm-hmm.
are there any lifestyle changes that
Mm-hmm.
can make a big difference for someone living with AHF?
Absolutely.
Okay.
Diet is a great place to start.
Huh.
Following a heart-healthy diet that's low in sodium,
Mm-hmm.
saturated fats, and trans fats. It can help lower blood pressure,
Mm-hmm.
cholesterol levels,
Yeah.
and your overall risk for cardiovascular problems.
Okay.
Focus on nutrient-rich foods like
Right.
fruits,
Mm-hmm.
vegetables,
Okay.
whole grains,
Yeah.
lean proteins,
Mm-hmm.
and healthy fats.
So it's not just about what you avoid,
Right.
but also what you
It's about what you add to your plate.
add to your plate.
Right.
Yeah, exactly.
What about exercise?
Yeah. I know that physical activity is generally good for you,
Mm-hmm.
but are there special considerations for someone with AHF?
Exercise is definitely important for overall health,
Okay.
but it's crucial to talk to your doctor before starting any new exercise program,
Okay.
especially if you have AHF.
Yeah.
They can help you figure out what types of activities are safe
Right.
and appropriate for your condition and fitness level,
Okay.
starting slowly
Mm-hmm.
and gradually increasing the intensity and duration of exercise is key.
So listen to your body and respect its limits.
Exactly. And don't forget about stress management.
Oh, absolutely.
Stress can have a real impact on heart health.
I know. When I'm stressed, my heart races.
That's because stress releases hormones
Okay.
that increase your heart rate and blood pressure,
Mm-hmm.
putting extra strain on your heart.
Okay.
Finding healthy ways to manage stress,
Yeah.
like deep breathing exercises,
Mm-hmm.
meditation,
Right.
yoga,
Yeah.
or spending time in nature
Yeah.
can be incredibly beneficial
Okay.
for both your physical and emotional well-being.
It's about finding what works for you and
No.
making it part of your routine.
Exactly.
What about sleep?
Yeah,
Does sleep quality play a role in AHF management?
it absolutely does.
Okay.
Getting enough sleep is crucial for a healthy heart.
Oh, okay.
When you're sleep deprived,
Mm-hmm.
your blood pressure,
Yeah.
heart rate,
Uh-huh.
and inflammation all increase.
Okay.
Aim for 7 to 8 hours of good quality sleep every night.
Okay.
If you're having trouble sleeping,
Yeah.
talk to your doctor, as there might be underlying sleep disorders
Okay.
that need to be addressed.
It seems like everything's connected
It is.
when it comes to heart health.
Yeah.
It's a reminder that taking care of our hearts is a
Horrible.
whole body approach.
It's a whole body approach, absolutely.
We need to consider the physical, the mental, the
Yeah.
emotional,
Yeah,
and even our behavioral well-being.
absolutely.
Now, before we move to the final part of our deep dive,
Okay.
I want to circle back to something we touched on earlier,
Yeah,
pulmonary edema,
right.
that scary complication of AHF.
Yes, pulmonary edema is a serious condition
Mm,
that requires immediate medical attention.
right.
It's basically a buildup of fluid
Mm-hmm.
in the air sacs of the lungs,
Right.
which makes it really hard to breathe.
Yeah.
Remember those symptoms we discussed earlier?
Yeah.
Shortness of breath,
Yeah.
difficulty breathing lying down,
Yeah.
and coughing up pink frothy sputum?
Right?
Those are all classic signs of pulmonary edema.
It's a scary reminder of how quickly
Yeah.
AHF can escalate.
It is.
Our sources explain that pulmonary edema is often triggered by increased pressure
Right.
in the pulmonary capillaries,
Yeah.
those tiny blood vessels in the lungs.
Right.
This increased pressure pushes fluid into the air sacs, making it difficult to exchange oxygen and carbon dioxide.
It's almost like a dam breaking,
Okay.
overwhelming the lungs' natural drainage system.
Yeah.
Our sources also mention hydrostatic and oncotic pressures.
Okay.
Think of it as a tug-of-war happening in your capillaries.
Okay.
Hydrostatic pressure is the force pushing fluid out of the capillaries,
Okay.
and oncotic pressure pulls fluid back in.
Gotcha.
In pulmonary edema,
Yeah.
the force pushing fluid out wins,
Okay.
leading to that fluid buildup in the lungs.
Okay, that makes sense.
Yeah.
Now, we've discussed the causes and symptoms of pulmonary edema,
Right.
but how is it treated?
The main goal in treating pulmonary edema
Okay.
is to get more oxygen into the blood
Okay.
and reduce the fluid buildup in the lungs.
Right.
This often involves a combination of
Okay.
oxygen therapy,
Mm-hmm.
medications,
Yeah.
and in some cases, mechanical ventilation.
Okay, so it's a multi-pronged approach.
Exactly.
Okay, let's break those down a bit further.
Okay.
Starting with oxygen therapy.
All right.
That seems crucial for getting those oxygen levels up.
You're right. Oxygen therapy is essential.
Okay.
It's usually given through a nasal cannula or a mask, depending on how much help the patient needs to breathe.
Okay.
The goal is to increase the amount of oxygen in the blood,
Yeah.
which relieves shortness of breath
Okay.
and improves oxygen delivery throughout the body.
And what about medications?
Yeah.
Which types of drugs are commonly used in treating pulmonary edema?
Diuretics are often the first choice,
Okay.
as they help to remove excess fluid from the body,
Mm-hmm.
including the lungs.
Okay.
It's like releasing some of the pressure from that overflowing dam we talked about.
Oh.
Doctors might also use morphine sulfate,
Okay.
which can reduce anxiety and dilate blood vessels, easing the workload on the heart.
Interesting. I know nitroglycerin is often used for chest pain.
Yeah.
But is it also used in pulmonary edema?
Yes, it
Okay.
is. Nitroglycerin is a vasodilator,
Okay.
meaning it widens blood vessels.
Mm-hmm.
This helps to lower blood pressure
Okay.
and reduce the strain on the heart.
Okay.
It's often given intravenously or under the tongue for quick relief.
What about those ACE inhibitors we talked about earlier?
ACE inhibitors like captopril and enalapril
Okay.
also help relax blood vessels
Okay.
and reduce fluid buildup, easing the burden on the heart.
Okay.
They're frequently used alongside other medications
Right.
to manage both AHF and pulmonary edema.
So a team effort from different medications.
Yeah, a team effort.
In more severe cases,
Right.
is mechanical ventilation ever necessary?
Yes, if the patient is having a really hard time breathing, mechanical ventilation might be needed
Yeah.
to help them breathe and ensure they are getting enough oxygen. It's like giving the lungs a break while the heart recovers.
That makes sense. Pulmonary edema sounds like a very serious condition.
It is a medical emergency
Yeah.
that requires prompt and aggressive treatment.
Okay.
But the good news is that with quick action, the outlook for pulmonary edema is generally good.
That's reassuring to hear.
Yeah.
Even with a positive outcome.
Yeah.
It's a clear warning sign of the importance
Right.
of managing AHF effectively
Absolutely.
to prevent complications like this from happening.
Exactly. It's a reminder that staying vigilant and managing your condition proactively
Right.
are key to living well with AHF.
You know, we've talked a lot about the physical aspects of AHF,
Yeah.
but what about the emotional side of things?
That's an aspect that often gets overlooked.
Yeah.
AHF can be an incredibly scary and stressful experience.
Right.
Not just for the person going through it, and also for their loved ones.
It's not just a physical challenge, it's an emotional one too.
Absolutely.
What are some of the psychological hurdles
Okay.
that people with AH might face?
So anxiety and depression are common.
Okay.
The sudden onset of symptoms,
Yeah.
fear of what might happen, the limitations imposed by the condition,
Right.
and the possibility of life-altering changes.
Yeah.
All of these things can contribute to feelings of anxiety,
Okay.
worry, and sadness.
It must feel like your world has been
It does.
turned upside down.
Exactly.
For some people,
Yeah.
the physical limitations of AHF can be really frustrating.
It can.
Imagine struggling to do everyday things.
Yeah.
That used to be easy.
Exactly.
It can lead to feelings of helplessness and even anger,
Right.
a sense of loss,
Yeah.
and lower self-esteem. It's like a loss of independence,
It is.
which can be incredibly tough.
Yeah.
And for those with severe AHF, needing constant medical interventions,
Right.
maybe even a heart transplant,
Yeah.
that adds a whole other level of complexity.
Absolutely.
Facing major surgery.
Yeah.
The uncertainty of finding a donor.
And the possibility of complications
Yeah.
can be overwhelming.
So it's clear that AHF is more than
Yeah.
just a physical health challenge.
It is.
It's a mental and emotional battle as well.
Absolutely.
What advice would you give to someone
Okay.
struggling to cope with the emotional side of this condition?
First and foremost, remember that you're not alone.
Okay.
Many people with AHF
Yeah.
experience similar emotional challenges, and there are resources available to help.
Like support groups.
Exactly.
Okay.
Support groups can provide a safe and supportive environment
Okay.
where you can connect with others
Yeah.
who truly understand what you're going through,
Right.
sharing experiences, coping strategies,
Yeah.
and words of encouragement
Yeah.
can be incredibly helpful.
There's strength in knowing
Yeah.
they're not alone.
Absolutely.
What about individual therapy? Could
Mhm.
that be beneficial
Definitely.
for someone with AHF?
A therapist can help people process their emotions,
Okay.
develop coping mechanisms for stress and anxiety, and adjust to the changes brought on by AHF.
Right.
They can also provide guidance
Okay.
on communicating with loved ones
Yeah.
and navigating the challenges of living with a chronic condition.
So having someone to talk to who understands
Right.
the challenges can be incredibly beneficial.
Absolutely.
And remember, medication can also play a role
It can.
in managing the emotional symptoms of AHF.
Yeah.
Antidepressants or anti-anxiety medications
Mm-hmm.
might be prescribed to help alleviate feelings of anxiety and depression,
Right.
improving overall mood and quality of life.
Exactly.
It's good to remember that mental health
Yeah.
is just as important as physical health,
It is.
and there are effective treatments available for both.
Absolutely. It's all about taking a holistic approach to well-being, focusing on the mind, body, and spirit.
Okay, I think we've done a great job of exploring AHF from the patient's perspective, but what
Yeah.
about the doctors,
Right.
nurses,
Yeah.
and other healthcare professionals who
Yeah.
care for people with AHF?
Yeah.
What are some of the challenges they face?
That's an important perspective to consider.
Yeah.
They're on the front lines.
So we've talked about, the individual challenges of AHF and
Yeah.
what someone diagnosed might go through.
Right.
But now I'm thinking bigger picture.
Okay.
What can we do as a society
Yeah.
to tackle AHF before it even starts?
Well, imagine a world where
Okay.
living a heart-healthy lifestyle is just the norm.
Right.
It starts with education,
Okay.
public health campaigns
Mm-hmm.
that raise awareness about the risks of heart disease
Yeah.
and show people how to make healthy choices.
So kind of like those
Yeah.
clever anti-smoking ads, but for
Engaging campaigns
Mm-hmm.
that empower people.
Okay.
Think community programs,
Yeah.
promoting physical activity,
Okay.
making sure everyone can afford healthy foods,
Mm-hmm.
and initiatives that reduce stress and boost mental well-being.
It's about making those healthy choices the easier choices.
Exactly.
I love that idea.
Mm-hmm.
But what about the people who are already
Right.
dealing with heart failure?
No,
How do we support them?
you're hitting on a crucial point.
Okay.
We need to make sure everyone has access
Mm-hmm.
to good, quality, affordable health care,
Right.
including programs that catch and treat heart problems early.
Okay.
That means making sure diagnostic tests,
Mm-hmm.
medications, and cardiac rehab programs are readily available.
And we can't forget about the emotional support aspect. We
Right.
talked about how anxiety and depression can really affect
Absolutely.
someone with AHF.
Yeah.
Mental health services need to be part of the whole care package.
Couldn't agree more. Community support is a big deal, too.
Okay.
Support groups,
Yeah.
whether in person or online,
Mm-hmm.
can be a real lifeline for folks with AHF
Right.
and their families.
Yeah.
They offer a place to connect with others who get it,
Mm-hmm.
who understand what you're going through.
A network of understanding and encouragement can make a huge difference.
Absolutely.
Now, switching gears for a bit,
Okay.
what about research?
Yeah.
What are some of the exciting areas scientists are exploring that could lead to better treatments for AHF?
One really cool area is regenerative medicine.
Okay.
Researchers are figuring out how to repair
Mm-hmm.
or even replace damaged heart tissue
Wow.
using things like stem cells.
Okay.
Imagine being able to regrow healthy heart muscle.
Yeah, that does sound like science fiction.
That's the future we're talking about.
What about personalized medicine?
Right.
I know it's a big deal in healthcare these days. How could that help with AHF treatment?
Personalized medicine is all about tailoring treatment to the individual. It uses genetic information
Mhm.
and other unique characteristics
Okay.
to figure out exactly what each patient needs.
Gotcha.
For someone with AHF,
Yeah.
this could mean using genetic testing
Okay.
to predict how they'll respond to certain medications,
Okay.
which leads to more effective treatment plans.
It's like customized medicine,
Yeah,
taking into account everything that makes you you.
exactly.
Are there any cool gadgets or devices on the horizon that could make AHF management easier?
Definitely.
Okay.
We're seeing amazing advances in wearable technology.
Okay.
Think about devices you wear
Yeah.
that can monitor your heart rate,
Mm-hmm.
rhythm,
Okay.
even your fluid levels,
Wow.
all from the comfort of your home.
Oh.
This data can alert doctors to early warning signs
Right.
that AHF might be getting worse,
Yeah.
allowing them to step in quickly
Okay.
and potentially prevent hospitalizations.
It's like having a personal heart monitor
Exactly.
right on your wrist.
Right there on your wrist.
Yeah. As we wrap up this deep dive,
Mm-hmm.
I'm feeling pretty hopeful.
Good.
AHF is a complex condition,
It is.
but with ongoing research,
Yeah.
new treatments,
Mm.
and a commitment to heart-healthy living,
Right.
we can make a real difference for people with this condition.
I couldn't agree more.
Okay.
It's about empowering individuals, supporting healthcare professionals,
Right.
and building a society that prioritizes heart health.
Yeah.
Together, we can work towards a future
Mm-hmm.
where AHF is no longer such a burden.
What an inspiring message.
Mm-hmm.
This has been an amazing exploration of acute heart failure.
Yes?
We hope you, our listener,
Mm-hmm.
feel like you have a deeper understanding of this condition.
Yeah.
And we encourage you to take charge of your own heart health.
Absolutely.
Remember, knowledge is power.
It is.
So keep learning, keep asking questions,
Yeah.
and keep advocating for your well-being.
And remember, you're not in this alone.
Yeah.
There's a whole community out there ready to offer support, knowledge, and hope.
Keep exploring, keep connecting, and
Yeah.
keep believing in the power of resilience.
Absolutely. We're all in this together.
Yeah.
And together we can make a difference.
That's a wonderful thought to end on.
Mm-hmm.
Thank you for joining us on this deep dive
Yeah.
into the fascinating world of acute heart failure.
It's been a pleasure.
Until next time, stay curious,
Mm-hmm.
stay informed,
Yes.
and most importantly, stay heart healthy.
Absolutely.
Yeah.